Okay, I think we are good to go. Welcome. Good morning, everybody. We left off a chunk of the way, maybe a quarter of the way into the chapter. So I left you with herpes simplex type 1. We showed some images of that, and the next, as we think about some GI issues, would be candidiasis. So candida overgrowth, when we think about in the oral cavity, we call it thrush. There are oftentimes, when we think about something like this, it might be more common with little kids to see some of this, but there are other opportunities. And just like thinking about other issues with antibiotic usage and disrupting the flora, similar occurrences could happen in the mouth, lending to an overgrowth of the candida. And these yeast cells live as part of the normal flora, but held in check by other microbes. And so when something's a little out of whack, it opens up the avenue for these guys to truly get a stronghold. This next image, and I feel like we've seen this before, probably respiratory, we mentioned it as well. So with mumps, in this image, we're seeing the parotid swelling. There are numerous things that we will think about. It is something that we recognize as an aerosol or droplet transmission, and fitting with this. We'll hit the table of this and go through a little bit of details with some of the aspects of it here in a moment. And I switched this up. Let me stop this share. I'm on top of it today, maybe. And I got the textbook opened to hopefully give us some better details with this. So that maybe. So I'll flip back and forth to this table as we move through this chapter, so it's a little more clear as we are moving through here. So to start off with the last bit of the oral infections, there are handfuls that we have talked about last time and a little bit that we just saw today. So Streptococcus mutans, as I was describing on Monday, is the main player when we think about cavity-causing culprit. There are other bacteria that get in and interact, but mutans is truly the one that causes the issues. So it's non-transmissible. It's bacteria that's normal within the mouth. And it truly kind of depends on the circumstances as far as, kind of makes me think like those yeast cells. If you get bigger proportions of one guy over the other, that sets the stage for potential issues. And so if the stage is set for mutans to thrive, sugary meals, things like that are a diet that it would choose, it opens up more potentials for a greater amount of these and the issues. So we saw the strep mutans, the gingivitis and periodontitis. There are a handful of organisms that interact with this, and we think about the formation of plaque and tartar and inflammation of the gums. Porphyromonas, Streptococcus, and Actinomyces are three of the big players within this. And I know Porphyromonas gingivalis, I could be wrong with that species name. There's been quite a bit of research going into this bacterium, trying to figure out if there are some mechanisms that we could utilize, whether it be something like a vaccine or something like that, that would prevent this microbe and hopefully prevent periodontitis. Maybe, maybe not. So they're still doing research. Another tidbit I will share, and it goes into the research with the Porphyromonas. And this is something that, in passing, part of the research that they were looking at with this and potentially finding things, because there's some toxins that I believe are released from these bacteria, and they're trying to think about maybe blocking some of that as well. They recognized some other issues and found potentially that this bacterium could be maybe a culprit for causing Alzheimer's disease. We aren't certain with that, but they think about this organism and all sorts of issues with it being in your mouth and then potentially into the bloodstream, possibly crossing the blood-brain barrier, lending to issues. And there are all sorts of thoughts of the plaques that they speculate are Alzheimer's, that now they're questioning potentially it's an immune response against this pathogen and not the actual disease, different situation. Like I said, that's kind of just in passing. I don't know. I think if it was something that they found some more strong evidence, we'd be hearing more details about it, because I first caught wind of that, I think maybe 2 years ago. So, I mean, we have been in a pandemic and things have kind of shifted a bit. More probably turning away from your gingivitis to some other things that might be more pressing. But I feel like, you know, Alzheimer's is something that's on lots of people's radar. Moving down, the herpetic gingivostomitis, this is type 1, herpes type 1, and it's the lesions in the mucous membranes of the mouth, more than just the cold sore on your lips, right? That's what we're looking at with that. And then I'm skipping over the treatments. There are some potentials, depends. Mumps that we just left off with is a type of paramyxovirus virus. It causes all sorts of issues, more than just that swollen parotid gland. There's weakness and fatigue, loss of appetite with a swollen parotid gland, pain while chewing. There is the potential in some serious cases for encephalitis, meningitis, inflammation of the testes, ovaries, and breasts. Mumps back in the day when this was something that we didn't have a vaccine for, if you contracted mumps, it was a pretty common occurrence to be rendered sterile. Almost always, right? Really pretty crazy. So, you know, I mean, it's crazy to just think that a virus could do something like that. We don't think about those details. Why? Because we're vaccinated, right? That should be why. There is no treatment, but there is prevention with vaccination. Thrush, we started with, and the Candida albicans. There are some others, but albicans is the main player when we think about that. So the white kind of overgrowth, the pseudomembranous growth in the mouth, there are some potentials for some bleeding. And like I said, it is your normal flora. It's non-transmissible. It's stuff that you already got going on. So there are a few antifungals dependent. We talked about trench mouth as well. There are a handful of bacterial culprits that can cause this. The trench mouth was also acute necrotizing ulcerative gingivitis. And looking at this last one, Treponema vincenti, it's also called Vincent's disease, all right? Giving credit to him. So whoever, I don't remember all of those details. So Prevotella, Fusobacterium, and Treponema are three of the genera that can cause trench mouth, and there are a couple of others, but these are the main ones. So erosion of the gums, ulcers, there's serious pain and halitosis. So also thinking normal players, the situation's getting kind of out of whack as well. All right, let me stop this. Maybe is that my PowerPoint? That is my PowerPoint. Okay. So this it almost seems out of place, right? But we are talking GI tract infections, so we'll want to think a little bit about food safety as well, all right? And I feel like, there's no point in this PowerPoint that really seems like a fitting spot for it, but this is. We are moving downward. So as we are shifting from the oral cavity, it probably is fitting to throw this in here right now. There are all sorts of potentials for us to come in contact with things that potentially could make us very ill. And thinking about how we handle these products, keeping them cold or keeping them warm, either way, depending upon the product, helps to ensure that possible pathogens don't have an opportunity to get in there, to thrive, to replicate, potentially releasing toxins, maybe. It depends on the type of bacterium. And then in turn, make its way into us, all right? So it really kind of depends on the circumstances. We talked about some mechanisms with dealing with microbes in the first place. That was second exam, I believe, maybe it was the third, where we talked about maybe temperatures, cooking things, pasteurizing, steam sterilization, freezing something or refrigerating something. Not every mechanism is going to kill pathogens. It depends on what you're doing, all right? There are all sorts of details as we look at this thermometer. The danger zone is in between 4 degrees and 60 degrees Celsius, or 40 to 140 degrees Fahrenheit. So foodstuffs that are kept at this temperature, basically room temperature out on the counter, all right, sets the stage for potential issues, all right? And if they're at refrigeration or at warmer temperatures, although room temperature is lower than 140, you would surely hope, right? But right within here, right? So holding temperatures as we look down below for cooked foods or reheating stuff like cooked ham, 60 or 140 degrees Fahrenheit is a safe temperature for that. We bump it up as we start looking at other things. Beef and pork, this looks like a meat thermometer as we're looking through this stuff. Veal, roasts, steaks, things like that need a little bit more, all right? Egg dishes and some ground meat, more, and the ground beef or other meats are more of an issue because the potential for bacteria that's on the surface of that meat, once it's ground up, is now throughout the whole product. And so it's not just the surface, right? And hamburgers or other ground meats that aren't cooked thoroughly set the stage for those microbes to still, have the viability as an issue to cause infection in you. The last one, poultry, stuffings, casseroles, and reheating of leftovers should be heated up higher, 165 or 74 degrees Celsius. And there are, as we've described, issues with some microbes that might thrive or survive, maybe not thrive, at cold temperatures like refrigeration temperatures. And that sets the stage where you think you're doing something proper, but you ultimately are just lending to the propagation of some of this and issues, right? Also, possibly freezing stuff may or may not render those things free of microbes, right? There are all sorts of different types of bacteria or parasites that may be able to survive freezing temperatures. There are others that it depends on how long. If it's been in the freezer for at least a week, probably you're good to go, right? So it kind of depends, right? And there's other mechanisms as far as how things might be frozen. That also sets the stage. Sometimes commercial Fisheries, stuff like tuna is blast frozen, so it's almost like instantaneously frozen. It's not put into a regular deep freeze or, you know, your household freezer and frozen that way, right? Almost the instance that it was caught, it was frozen and frozen solid, right? And in those mechanisms, potential parasites that might be thriving in that type of fish are killed, right? So kind of just depends, all right? And again, this area is the area that you would try to avoid. We will move through and talk about a few of these things that we potentially can see from maybe the improper handling or not cooking things thoroughly, whatever it might be, that sets the stage for some issues. So this image is of a bacterium Shigella causing shigellosis, and there are a handful of types of these guys. It is something that we've done a little bit of stuff in the lab, plating different bacteria on selective and differential media, and some of these things, that type of media might help to lend us down the pathway to truly figure out what we're looking at, all right? So in this image, we're looking at a stool sample, and so there are red and white blood cells that we've got pointed out in here. The white blood cells, no nuclei, they just look like little kind of tannish discs. And then the big globs in here that are kind of more purplish colored are the white blood cells, the nucleated cells, right? So there's lots of white cells and some red blood cells and bacteria all over the place, right? First off, in a stool sample, you would expect to see bacteria all over the place. That's what a stool sample is, right? There's a lot of bacteria in that, all right? Billions of bacteria in a single gram of feces, which is about the size of a pea, all right? That's not much feces to have a huge amount of microbes, right? So one would expect to find a tremendous amount of organisms, but you wouldn't expect to see some red cells, right? Maybe a little bit of white blood cells, but not huge quantities like this. The red cells for sure, an issue, all right? So indicating that there's something in there causing damage and maybe feeding on these red cells as well, all right? So there are a handful of GI issues where we will see some diarrhea, and the question is bloody or non, lending us down specific avenues. We started this chapter with the E. coli, the 0157H7. There are boatloads, bless you, boatloads of E. coli out there, and they have all sorts of different potentials, all right? The E. coli living in our guts normally doesn't cause bloody diarrhea, right? Or we would have some serious issues, all right? But the 0157 does, all right? Types of Shigella also can, all right? So there are, just because you see bloody diarrhea doesn't mean you immediately know it's this bacteria, but you've got some hints, all right? As far as what it could be. There are also other things besides bacteria. There are some amoebas that could cause some bloody stool as well. So that, and we will hit it here in a second, might be recognized in a stool sample with some large amoeboid-like cells along with the bacteria. And then we'd be thinking something else going on, all right? So Shigella is a good food poisoning agent. So too is salmonella. Salmonella is something that's probably more common. I should have looked up these details, got you some statistics to tell you levels of this, but I didn't. So salmonella is, like I started this chapter last time thinking about E. coli and saying, oftentimes when I think about that, I think about ground meats as more of a culprit, but we've progressed to think more things different types of produce, all sorts of things that potentially could be tainted with E. coli. There are other things that also could cause these issues. Salmonella is another one. And a bacterium that, for me, I typically think of salmonella being common in poultry products. Chicken, eggs, things like that definitely have a likelihood of harboring some salmonella. Salmonella is normal in these birds. It's normal in the digestive tract of the bird. It potentially gets on the egg in transit out of the chicken, lending to you potentially getting infected, right? It depends on where you get your eggs, right? If you go to the supermarket, pretty unlikely that the outside of the egg is going to make you ill, right? They have been washed, and that's why they're refrigerated, right? If you get chickens from your backyard and they aren't washed, well, it's a different story, right? And those eggs don't have to be refrigerated, right? They stay good, right? There's an antimicrobial film on the outside of the egg, and there's also potentially some bacteria, right? So people oftentimes mistakenly think by rinsing their egg off or cracking it very carefully, no shell got into any of this, I'm all fine and good. And it doesn't matter what I do with these eggs after that. I didn't get any shell in that. But that's a problem because salmonella is part of the normal flora of that chicken. And in the process of shell formation or egg formation, the bacteria can inoculate or incorporate into the inside of the egg before the shell ever forms around the outside of it. So just because you think the egg looks clean doesn't mean there's not salmonella on the inside. So the consumption of raw eggs, I would say ill-advised, all right? I would avoid that, all right? But people still do it, right? Delicious. I think not, right? So here we can see some salmonella. This is an electron micrograph of the bacterium and some intestinal epithelial cells as the bacteria is getting in and trying to kind of wedge its way in there and establish to start proliferating and cause disease. Shigella, salmonella, and we'll move through and see some more bacteria and then bump over to the tables. Lots of the symptoms are pretty similar, all right, as we move through here. And there are a few things that start to differentiate, like the possibility of bloody stool or not, all right. This next one is always something that just disturbs me. Cholera is a bacterium that plagues humanity. It causes all sorts of issues, potentially fatal issues. We oftentimes think about poor sanitation, issues that set the stage for this microbe to thrive and to potentially become infectious to us. Contaminated drinking supply is a common source of cholera, but it doesn't have to just be that, but that's kind of the main idea. Produce, fruits or vegetables could be contaminated with it, again, probably with the water, right? Contaminated, and then if it's not properly cooked, you eat these vegetables raw, potentially setting the stage for that as well, all right? So in our first image, we can see this water. It looks very dirty. She looks like potentially washing some laundry. There are probably, if we were to look a little bit, pan out, and look a little bit further down, people getting their drinking water. There's probably people using the bathroom into this waterway as well. There's all sorts of things that it's used for, all right? And that's an issue, all right? Cholera likes kind of this brackish water. It likes a little bit of saline. So seeing it in coastal regions is potentially pretty common for that. Again, dependent upon, circumstances. It's oftentimes seen after types of disasters. In Haiti, we've seen some issues, earthquake and hurricanes that set the stage for problems with infrastructure all the way around, all right? And so sometimes we see big outbreaks as the result of the aftermath of some sort of natural disaster. And it, is the result of contaminative issues really in the first place. So this image is impressive. You can see their cots that they are laying on and a hole cut here. Here we've got another one. This one looks like it's about ready to be utilized, all right? These people are severely ill and they have copious amounts of diarrhea. So much so that a little bedpan's not going to do you any justice, all right? You got to bust out the 5-gallon bucket, all right? Huge volumes can be lost in a day, all right? And that 5-gallon bucket in a severe case of cholera, in a single day, an individual can defecate that much fluid into the bucket, basically topping that sucker off. And if you think having 5 gallons of diarrhea isn't going to kill you, I think you're sorely mistaken, all right? Super serious issues, all right? These people need fluid replacement, and they need mass quantities of that to try to deal with this severe dehydration that they are in the grips of. Disturbing, all right? So here we can see an actual image of this, of our Vibrio, and probably a filter in the background that we've filtered some water through to see this, because I see some porosity on here that makes me think that's probably what we've got going on. It also could just be what it's mounted on to be visualized through there, but interesting, all right? So cholera, definitely, as we think about some of these pathogens, a super severe one, definitely a serious situation, all right? Cholera causes, and I've shifted to Helicobacter, but cholera causes this, massive amount of diarrhea. You get a bunch of mucus that's being secreted. It messes with the sodium channels. You get huge amounts of mucoid diarrhea, and lots of lipid in there as well. They sometimes describe it as rice water stools. And a interesting tidbit, a fun fact, they have seen some interesting things with people with cystic fibrosis. And these individuals have super thick mucus, right? In the respiratory and GI, sometimes it's one or the other, right? But if your GI tract is full of super thick viscous mucus, it becomes very difficult for nutrient absorption. There's all sorts of problems that you got going on, all right? These individuals are immune to cholera, which is pretty crazy, all right? Doesn't plague them. My guts tell me that these cystic fibrosis people, if they were to contract cholera, all of a sudden their mucus levels would kind of be normalized. They probably would feel good, right? It makes me wonder, we inject Botox, we inject botulism toxin into our faces. Could we not possibly use a cholera toxin as a potential therapeutic for us? Maybe they already do, all right? I don't know that, but it makes me wonder, could that be an opportunity for that, all right? There are lots of people that are carriers of the CF gene, and with that, I think they get cholera, they get the ill effects, but it is not super severe, all right? Not something like you're going to crap yourself out, all right? So it does kind of, make you wonder, could there be something there? All right. Okay, enough of that. Shifting over, Helicobacter. I don't remember if I told you guys this or not, but the individuals that discovered this, they drank down some Helicobacter just to see, right? That's kind of crazy, right? Kind of extreme. You really shouldn't do science on yourself, right? Probably not wise, all right? But we ultimately know quite a bit now because of that. So, all right. Helicobacter is an oddball because this organism, it would like to live in your stomach. And pretty much nobody wants to say this is a perfect place to live, right? But Helicobacter is like, I can do this, right? And ultimately does a really great job of living there in the first place. So we've got a couple of images, the normal, and then here's an infected. So we've got a little bit of an ulcer right here in the stomach. So this image below is showing kind of what's up over here, the healthy bit, and then where the bacteria come in and cause these issues. So there are numerous things within the stomach. The gastric secretions, highly acidic. The mucus layer helping to prevent the stomach cells from digesting themselves, all right? And Helicobacter gets in and it colonizes. It sets the stage with some buffering capacity to neutralize the stomach acids, to create an environment that is protected so that the acids aren't destroying it. And it causes an ulcer as it makes its way in and destroys the cells going in deeper, potentially causing bleeding ulcers if we get deep enough in there. As this happens, we can see, and up above, the layer that should be there to help provide some protection is no longer present. And now stomach acids are coming in contact with these cells, and that causes some serious pain, right? Grab some Tums, right? And you just hope, right? And that can run to some vicious cycles as well, because people with some serious Helicobacter stuff going on have some severe pain. They probably are eating handfuls of antacids. And as this happens, all of the buffering capacity gets out of whack and your stomach's like, shoot, I ought to pump out some more acid, right? And so then your stomach tries to counteract that and you grab more Tums, right? And if you do it right, now you've overdosed on Tums and all you can do is pass out and hyperventilate for a minute to try to bring your pH back down, right? That's not good, right? And then you're like, dude, I got to go to the doctor. Something's up here, right? I ate a whole bottle of Tums, right? That's not good, right? Okay, and there we go, all right? If you have ulcers, you have Helicobacter, but if you don't, right, you have to have this organism to have that going on, all right? So, kind of a crazy thing. Clostridium, we've talked about this with some of the antibiotic stuff and the potentials for an overgrowth of this bacterium as a result of taking antibiotics for something else, all right? Probably nothing to do with the GI issue in the first place, but now all of a sudden you've got GI issues, all right? So the Clostridium is a bacterium that we have as some normal flora, right? Low levels, right? But if the normal microbes get out of whack, again, typically antimicrobial therapy, it sets the stage for these guys to truly proliferate, all right? So they secrete some toxins. They're able to penetrate in there, destroying cells. We get an inflammatory response, potentially a very serious inflammatory response. The bacteria can create this kind of pseudo membrane on the surface. There's all sorts of issues and ill effects that you're feeling from this, all right? Say pseudomembranous colitis with the bacteria, dead cells, pus, all sorts of stuff that's covering this now. Okay, let me stop. Holy, I was like, oh no, did I just close that off completely? Wouldn't that be sad times? All my Zoomers, I just X'd you out. No, I didn't. Okay, and I need to go here. Oh, there's my staphylococcal food poisoning. That fits right within here. I didn't mention my staph in there, but I sure should have. Oh, and typhoid Mary. Holy cow, there's so many good things in here. Oh, man, to the table. We'll come back to the E. coli and all of the different things. I mentioned handfuls of those guys. And Campylobacter. Oh, geez. This PowerPoint was really lacking as I'm scrolling through here. I'd have just taught right out of the book. Okay. Good stuff. Here we go. Hopefully you are seeing the table. Those of you zooming in. For you here in my audience, I know you're seeing it because I can see it myself. All right. There are lots of things and a few that as I was scrolling through there, well, we didn't actually talk about, but I could hit them right here. There are all sorts of GI culprits, and here we're just looking at some bacterial ones. Some of these things we think of as foodborne illnesses. Others can be some food poisoning, and in a poisoning situation, the pathogen, the bacterium, may or may not be present, likely not present, and it's the toxins that it secretes. That's what makes you sick. And as I was saying, oh, the Staphylococcus right above the thermometer there, Staphylococcus is a food poisoning. It's an intoxication situation. It secretes these toxins into some sort of product. Dairy products can be good ones like custards and creams and things like that for it to be there. So it could get inoculated from your own hands potentially. And then it's one that also can thrive at low temperatures. So you refrigerate that custard and the staph can grow, can release toxins, and then you can get sick, all right? Kind of depends on the circumstances. Bacillus is another one that we think of as a food situation. In this case, not a poisoning, all right? So a foodborne illness. The bacillus is one of the bacteria that's a spore former, all right? And Bacillus cereus, this is one you've probably looked at in the lab, all right? I think we used these guys when we did our gram staining way back, all right? Bacillus cereus is something that, again, can form spores, and it can be on rice, meat, or of some other products, but rice dishes are pretty common, all right? If the bacteria is there or if the spores were present on that product, it gets cooked, it gets brought back down to room temperature. Now it's in the danger zone, right? And not kept at a nice warm temperature or refrigerated after you have eaten, right? It's been left out longer. That bacteria can start to grow. Those spores can germinate. The bacteria can grow. We can ingest that and ultimately get sick that way. So there's nausea, abdominal discomfort and cramps, diarrhea, and or vomiting, maybe both, all right? So this is something that, you know, as far as drugs and treatment, basically you let it run its course, right? Fluid replacement likely, but nothing that we really can do. Campylobacter, this is one of the top of the list why Louis Pasteur pasteurized milk in the first place. All right. Campylobacter jejuni is a nasty pathogen, and it's normal flora in cattle. And in the process of milking the cow, it's highly likely you're going to get some contaminants in there. All right. So ingesting it that way, unpasteurized milk or undercooked chicken, contaminated water, set the stage for that as well. But it's the milk that's really kind of the main player with that. So fever and diarrhea, cramps and vomiting, sometimes dysentery. There can be other issues dependent upon the immunity of the individual. And there are some antimicrobials as potentials with it. There are definitely issues as we start moving through here, thinking about, do you use antibiotics or not? All right. Gram-negative bacteria, oftentimes when we think about a GI situation, if it's a gram-negative organism that's causing the problem, and they're pretty stinking common, all right? If it's one of those guys, you pretty much don't want to treat with antibiotics. The bacteria has that outer layer, the lipopolysaccharide layer, and it's antigenic. All right. If you start treating with antibiotics, you destroy the bacteria, releasing considerable amounts of those antigens. And that basically is like, adding insult to injury. It compounds the effects considerably. You thought you were dying. Now you are, right? It's bad news. All right. So there are a few instances when we're like, okay, we will employ some antibiotics, but oftentimes with gram-negatives, you try to be very cautious with that because it can cause issues, right? And you'll see some details with that. So here, cholera as an example, generally none. We typically aren't going to do that, but there are some circumstances where we're like, all right, we better try, right? And maybe, right? Usually, as I mentioned with this, fluid replacement's what we're thinking with the cholera. So severe diarrhea, fluid loss could lend to shock, renal failure, and death because of the severe volume loss. Clostridium, we showed that with the pseudomembranous colitis, more diarrhea, pain, loss of appetite, perforation of the colon as a potential with a serious case, right? And that can lend to septicemia, shock, and death. So again, overgrowth, there are issues for sure, all right? First off, we need to quit taking whatever other antibiotics we were taking that disrupted our intestinal flora to begin with, all right? And then some serious metronidazole, antifungal, antiparasitic, and vancomycin and or could be the drug of choice with this, and it's serious in these circumstances when we're employing this stuff. There are also potentials, and we've talked about before, fecal transplants lending to repopulating you with some good guys. The perfringens, another Clostridium, this one can cause some gastroenteritis, cramps and diarrhea. There is the potential for some hemorrhage. It can lend to gangrene, especially it's one that we think about with skin infections with that, but in the GI tract, it can lend to that as well. E. coli, there are numerous, and the table before I said I'd go back to, these are different types or strains of E. coli with respective targets that they have. So there's watery diarrhea, dysentery, cramps, malaise, fever, chills, and dehydration. With the EHEC, there's possible severe complications. I mentioned this is the 0157, the kidney destruction, hemolytic uremic syndrome. So contamination, ingestion of contaminated food or water, all sorts of things can serve as culprits for that. So dependent upon the type of E. coli, there are handfuls that are not recommended to be treated, and a couple that potentially may warrant some antimicrobials. And it depends on, what that bacterium is doing in the first place. Let me scroll back up. Where did that go? Did I skip right past it? Okay. Bear with me, folks. There we go. So some of our pathogenic E. coli groups, some, all right. So the enterotoxigenic E. coli, ETEC, it's a heat stable enterotoxin. So cooking stuff up, it's still present, right? When we think about food issues, some of these toxins, you heat it up and you destroy it. Others, still there, right? So this one's stable, you don't destroy it that way. So mild watery diarrhea, self-limiting. There are a couple of antimicrobials if needed, but typically a self-limiting infection, all right? The entero-invasive, so destroying cells as invades them. There's a couple of different genes encoded by some plasmids. Mild watery diarrhea could progress to dysentery, inflammation, inflammatory colitis as a potential supportive therapy, fluid replacement, not antimicrobials, because it runs to greater cell death with that. The enteropathogenic, fever, vomiting, non-bloody diarrhea, as opposed to the last one, right? Dehydration and possibly fatal. There are some instances where antimicrobials are warranted, but usually, again, we try to avoid. And this last one, you definitely want to avoid due to the impacts that they have on the red cells, causing greater issues to the kidneys than the bacterium's doing by itself, right? So mild to potentially severe, dependent upon the circumstances, dependent upon the age and immune status of the individual, are really big factors with that, all right? So I will stop with that. We will pick up next time with this next table, couple more, and then a few more pathogens for the GI tract. All right, guys, have a great day. I will see you Friday.